So this is going to be story time about my own shoulders, and this isn't to show you an example of what you should be doing with your shoulders, but more so the principles and concepts of how I would approach end range joint training, assessing how they feel, how well they work, and then making training decisions within that. And these are all concepts from functional range conditioning. Sarah and I use this kind of training exclusively for how we do our strength training for ourselves, assessing joint problems, working with one-on-one clients, and also the concepts for training that we use within our monthly program. So this is like an overall umbrella that heavily influences every decision that we make from training. Now, I have two shoulders. You can see that. However, they're very different shoulders. Historically, I've had trouble with my left shoulder going overhead. When I learned more about my shoulder joint, what I realized I lacked was a lot of ability to generate and absorb force in my end ranges of external rotation, like about that overhead position, and some in internal rotation. I used to get a lot of funky shit happening on the left side of my body, especially when I do overhead stuff, but also just a ton of weakness there that was very much relative to just lacking range of motion and my ability to use those end ranges. My right shoulder has always been my stronger shoulder, even now that I have a pretty substantial injury there that I never had repaired, which is a fully torn AC joint. So you can see here when I protract my shoulder blade, my collarbone just sticks out. That was a grade 5 tear of the AC joint that I didn't have repaired. I've used these concepts to, again, train this and make it work great. But how I train these two shoulders is very different. The positions that I work in, the intensity that I can use in my end ranges, and this is really just to explain some of the concepts because, especially for those of you who are watching this who are in our program, you can really apply these ideas, feelings, the way that I'm describing this stuff can and should be applied to how you're going through your own training as far as what you're experiencing and how you're adjusting those intensity knobs and yeah, basically that. So I'm going to explain this through really just internal rotation because that's something that I've really been actively trying to improve in my left shoulder. I'm going to use this setup with a kettlebell that I like, but this is one of kind of infinite positions and setups to use, and I'm going to try to show you the difference and explain because some of it isn't visual. A lot of it is what I feel when I go into these positions and try to load them, and that's really significant how they feel to you because even if I'm here training you, whether it's remotely in person, I can see what's happening and I can feel to some degree what's happening in there, although I don't have a ton of experience with, palpating joints and tissue. But what you're feeling is a huge component of what I need as far as information goes when we're training something, especially if we're really trying to assess a problem that's happening. And you paying attention to that when you're going through this training is hugely effective for those decisions that you make when you're trying to make something work better. Okay, so the setup that I often like to use here, you've probably seen something like a sleeper stretch before here. I could use a kettlebell, basically something to anchor my arm down. In this case, though, I'm going to do this where I'm laying on my back. And really what I'm trying to do here is essentially isolate my shoulder rotator cuff tissue in its end range. So if I just show you my end range of internal rotation, that's about there, especially if I really try to keep the scapula out of it. So I'm trying to keep this rear delt, back of my shoulder very firmly pressed in the floor. And when I go to that end range, I just have a stop there. Like there's no more range of motion, maybe a slight amount of tension that I can feel in those external rotator stretching, nothing in the front. I look at that as it feels right in that end range. It feels like I can load that position. I could grab onto this kettlebell. I could pull it off the floor here. It's strong in that position, not accidentally because I've done a shitload of training in that position to make it strong. Now, the difference with my right shoulder and left shoulder is that I can get right into my end range here. I don't have anything that feels very acutely uncomfortable. I don't have a significant amount of stretch on the opening side. I don't have any feelings of limitation as far as this closing side of the joint. These are all things that can come up. You might feel like the back is about to explode because it stretched so far. You could feel that the front of the shoulder is jammed up and very uncomfortable, especially when you add load and intensity to that. These are all feelings that we need to pay attention to because they're going to influence our training of that joint intensity, position, all of that stuff. Now, if I were to turn around here and show you this on my left side visually looks pretty similar as far as how much internal rotation I have. How it feels in this end range, though, is substantially different. Even though I've done a ton of training on it to even that out, there's still some last little bits that I'm working to clear up. And this is just, my ongoing efforts for training are making my long-term goal or to make my left shoulder work as well as my right shoulder. And it's the closest it's ever been, but I still have work to do. Like we all have a shitload of work to do training. So in this position, I go to my end range of internal rotation. Now I lifted that kettlebell off the ground with my right. Wasn't my max effort, but it's still relatively heavy. It's a 35-pound kettlebell, which I can do that on my left shoulder. However, I'm cheating a little bit with my shoulder blade. I'm not in as much internal rotation here, and this is something that's hard to see on camera, but if I go down in this position, you can see right here how my shoulder blade wants to lift up. That just means that for me to get into this position and load it with the same intensity that I do to my right, I need a little bit of help from my shoulder blade, where my other side, I can really isolate my rotator cuff and just use that joint by itself. It's got a little more juice in that end range. This side, it doesn't have that. I need essentially both joints helping together to be able to do that. So if I really try to take my shoulder blade out of it and I glue the back of my shoulder down and I go into that end range of internal rotation, when I hit that block, at that very end, I get some very acute tension deep in the back of my shoulder. Basically, at the limit of where those external rotators can lengthen. It's a very steep jump up in tension. While I am wanting to improve my actual range of motion a little bit, I suspect that that's actually more connective tissue limitation in that tissue that needs to stretch. That stuff at that angle, it's just at its limit of how much tension how much it can actually mechanically lengthen, and it's fairly acute. So I just know that that's tissue that I want to improve, because it doesn't feel, when I get to that limit, it doesn't feel like it's safe to load it with any intensity. So if I go to that end range, if I really isolate it, if I were to try to lift this kettlebell off in that angle, it would feel like probably would be an injury. It feels sketchy to do that. So obviously I'm not going to use a ton of intensity here. Also, in that specific angle, what I can load and to do it at a level that feels safe is very, very little tension. As soon as I go heavier than that, my body almost forces me out of that range where I lift my shoulder blade forward and I use tissue that can be loaded at that intensity. And that's really significant if my goal is to improve that aspect of my shoulder movement, because there's a million exercises out there for internal rotation. I could do standing Cuban presses and rotate with load. If I'm doing that, my chances of actually loading that tissue that needs to be loaded are really non-existent, because my body's going to organize in such a way where I just use the stuff that's able to do that and I bypass that other shit that has that lower loading capacity. So when we're making decisions on intensity and position, if we're working with tissue that has a low capacity, we need to cater to that and make sure that we're isolating and directing all that load into that tissue and doing it at a level that we can actually use that tissue. So if I'm going to do that, and I'm really doing this based on feeling, this is, again, it's not something that you can see because it's very specific. Here, I can pull up on this. I don't know, if I had a scale, I would estimate that I'm pulling with maybe 5 pounds of force. That 5 pounds of force lifting is enough where I can really feel that tissue being loaded. And when I do that repeatedly, the sensations of how much that tissue lengthens increases. I know that I'm putting length into that tissue and I can get a little bit more movement out of it. It also becomes a little bit less acute. I have a little bit more movement there. It feels better. It's a much better, less sketchy feeling after I do that. And that's something that took a long time for me to learn and practice and realize that this is something that's significant for everybody. So whether you're training your joints on your own, there needs to be a component of changing angles and trying to find a sensation of a limitation, like a shitload of opening angle tension is something that you should take note of and train that, right? Because the main goal of training is to improve these qualities that are lacking, wherever those might be. Now, those might be, getting your back squat to be heavier, which is a reasonable goal, of course. I support that goal. But if you're just doing that by back squatting more, you're going to get to a point where you're probably going to be limited by other stuff, like how much your hip joint can actually be loaded through its full range of motion. So when it comes to something like this, you just have to be mindful of all those components. And like the way that I do this on my left shoulder and my right, I'm training for similar goals. I want lots of capacity in those end ranges because that's going to help me do more stuff with my shoulders. It's going to make them more resilient for jiu-jitsu, but I don't do it the same way. When I do this often, I'll have 2 kettlebells set up where I'm training both my shoulders at the same time to try to save time. But what I'm doing with both shoulders is different. I may have a little less internal rotation on this side. I might crank my wrist down into extension on the right to pull my shoulder down. I might be trying to press the scapula into the floor. Essentially, I'm making these micro adjustments when I'm doing this to make sure that I'm targeting the stuff that feels the most limited. And that level of detail is important when you're trying to do this, because if I just slapped both of my shoulders in their end ranges, which is what I used to do when I first started doing this, I didn't understand the specificity enough. So I would just put both shoulders in the same position and I would just load them, and I wouldn't pay attention so much to how it felt. Yes, I'm kind of doing the same thing, but if I'm using the same intensity on my funky shoulder that is as good as my good shoulder, the outcome is different. And so that overall principle, I don't think this, I know this, I live this, because this is what I've had a lot of experience training my own body and other people, but I use these details and that information to the greatest level. Like, that's really what it helps me inform myself if I'm making the right decision for somebody to be training something, and it's also how I make my own decisions about how to make these adjustments. So it was a lot of specificity on a shoulder, but this just goes to show you that, you got 2 shoulders, they probably operate very differently in those end ranges, and every joint in your body is going to be like that because of injury history, the way that we move, train, sleep, walk, all of that shit. Life existence creates lots of differences in our bodies, and that's significant when we're training. So I hope that gives you some insight on how you can make different decisions when you're training, more informed decisions about what you're doing. And if you're totally new to this, it's worth exploring some of that. It could be done simply just by putting your shoulders into end range, feeling it out, giving yourself a little passive stretching, a little bit of isometric loading. We call these PALS contractions in functional range conditioning. You'll probably be pretty surprised at how your joints respond in their end ranges, and how your joints work in your end ranges really dictates overall what that joint is going to be good at, and what kind of stuff is going to piss it off. So I can't stress enough the significance of this information, just as far as getting to understand your own body, because for the most part in the fitness world, we have an approach of everybody does the same exercises, and we all expect that the outcomes are going to be the same. And if you've been in the game for a long time, or you've been training people for a long time, you realize that that's not the case at all. And of course we can make adjustments by changing exercises, but that's just a small fraction of what's available to us as far as making better decisions and really training somebody to increase the capacities where they don't have them, or where they're at the most limited. So if you have questions on any of that, or some other insight, I'd love to hear about it. Thanks.